Polycystic ovary syndrome is a common but often misunderstood condition. It can impact your fertility, carry long-term health risks, which make early detection and diagnosis extremely important. Let's explore how PCOS can impact your fertility journey. Polycystic ovary syndrome is a complex reproductive endocrine disorder. It impacts over 5 to 6 million women across the United States. It is primarily characterized by hormonal imbalances, but can impact almost every organ system in your body, which is why patients can look very differently. There's a lot of misconception around what a PCOS woman looks like. They have to be obese, they have to have excess hair growth. And while that's common, that's not always the case. So it's very important if you have symptoms, if you have concerns, that you share those with your provider and they can determine whether or not you actually meet criteria for that diagnosis. Most commonly, patients present with complaints of irregular menstrual cycles. That can mean skipping periods, going prolonged times without having a period. That can mean changes in the duration of flow and the amount of flow that you experience from one cycle to the other. As a fertility specialist, I often see PCOS patients when they are actively trying to build their family. It can be very difficult to track cycles, figure out when you're ovulating, and oftentimes they get false positive results with ovulation predictor kits. So if you have irregular periods, let's not wait trying at home. This is something you want to present early to your provider and share because you may have some ovulatory dysfunction that they can help diagnose and improve your chance of pregnancy per month. PCOS is still an enigma for us. We've done a lot of research characterizing PCOS, but we don't entirely know the cause. We know that there's a genetic contribution. We know that women, daughters of mothers who have PCOS, are at higher risk for developing PCOS throughout their reproductive life, and we see it clustered in families. In addition to reproductive risk factors, there's also risk to your metabolism and metabolic health. So women with PCOS are at risk for diabetes, they're at risk for metabolic syndrome and cardiovascular disease later on in life. In fact, a part of the screening process in PCOS is actually looking at lipid levels. So women with PCOS can have elevated cholesterol levels that impact their cardiovascular risk long term. So treatment is going to vary mainly based on symptoms, but the primary concern initially is regulating ovulatory function because that is going to improve so many of the downstream effects that are associated with PCOS. That's going to help with your fertility and improving your chance of pregnancy for months. It's going to decrease your risk of endometrial cancer. It can even improve your metabolic profile by decreasing abnormal hormone production that can drive insulin resistance and your risk for diabetes and heart disease. So it's all very much connected, and a part of that is just having a very clear treatment plan with your provider and sharing with them what your goals are. Your fertility journey is deeply personal, and we're here to walk alongside you, providing expert care every step of the way. Whether you're starting your journey